Hello and welcome to the session Leveraging 5G Technologies to Improve the Nation's Health and Wellbeing. I'm Wendy Coy, Director of Operations at the Warwick Innovation Group, and I'll be facilitating this session today. I'll be joined by colleagues from across the university and from BT. We're going to explore the art of the possible for 5G and health, and we hope to inspire you. I'll introduce them all as they take their slots. This is a Teams live event and it's scheduled until 12:45. It is being recorded, so I'm hoping that we should be able to get this to you in an edited form shortly. There's a question and answer area for you to post in as we go through the session, and we'll be rounding these up in a session at the end. In the interest of making the most of the session, please do try and put questions into the bar as you think of them and as we go through the session. As with all online sessions, the quality of the experience is in part dependent upon our individual technology and speeds. We've tried to keep it simple to aid the experience for you, and we hope that all the tech holds up. Just to start off with, I'd like to give you a little bit of context around the health and wellbeing in the region and the university position within it. Next slide. Next slide. Will enlarge on some of the challenges in health today, including COVID treatments, cures, vaccines, and conducting business as usual in changing conditions, methodologies of diagnosis, as well as all the usual challenges of time and cost, an ageing population, understanding the challenges and problems in this and new technologies. The creation of the solutions aren't all owned in healthcare though. New technologies, 5G, AI, data-driven solutions can be removed from healthcare practice, clinical practice, mental health, primary or social care, and solutions to address these challenges of keeping people healthier and self-managing and independently living for as long as possible can be in unrelated or related skills and expertise. So let's have a look at some of that across the region. Next slide. This slide here shows our physical spaces across Coventry and Warwickshire and beyond, and it identifies our approaches to the health and wellbeing in a strategic sense and our very real assets within the university, as you'll see from the middle section there, the med school, clinical trials unit, engineering, etc. And we'll look at the programmes that we engage with externally with a range of partners, alliances and networks to make our innovation district truly joined up. Apologies for the acronym in our alliances and partners, but just for your benefit, they are the Academic Health Science Network, Public Health England, the West Midlands Combined Authority, the Local Enterprise Partnerships, and Small and Medium Enterprises. We're a research-led university here with a very strong reputation for education, innovation and enterprise as part of the economy of Coventry and Warwickshire. We're the leading academic centre of excellence in the region for data-driven healthcare and technologies, and we're a founding member of the Alan Turing Institute and lead on its health theme. We've the largest academic grouping of data scientists in the UK who work across disciplines with our engineers, medics and health scientists on some of today's frontier health data questions. We've the largest number of externally funded doctoral training programmes in the UK, including the Doctoral Training Centre in Mathematics for Real-World Systems. We've played a major role in generating and analysing health data at many scales relevant to national COVID-19 response, including the modelling of health data for SAGE, behavioural change intervention design for SAGE and DHSC, AI for early detection, and new diagnostic tools for COVID-19. The University of Warwick has an extensive platform of facilities to support all of these collaborations, including our Health GRP, that's a global research priority, Institute of Digital Healthcare, the Zeeman Institute, Warwick Manufacturing Group, 5G Connectivity and Communications Technology, and the Institute for Global Pandemic Planning. We've also got the Science Park and the Innovation Group. The university works closely with leading innovation partners in our geography, including the South Warwickshire Foundation Trust, NHS Trust, with as well with a MAID at UHCW, that's University Hospitals, Coventry and Warwickshire. Silicon Spa Creative Cluster, the City of Culture Trust and a wide range of national and regional businesses and third sector partners, including BT. So our focus on health and wellbeing for the region we hope will inspire and educate and support the communities of SMEs, corporates, academics, students, alumni, healthcare professionals, and bring them all together to develop and deliver new products, businesses and services. I'd like now to hand over to call you to action, actually. Next slide. And tell you what we'd like from you from the end of this programme. We'd like you to join us. We'd like you to become a mentor, to request mentorship, to share your expertise, to work with us. If you're an SME, if you're a large corporate, if you're an inventor, an innovator, an investor, talk to us, please do. There'll be more details about this at the end. So I'd now like to hand over to David Plum, who is the Chief Innovation Officer at the University of Warwick. Great.
Thanks, Wendy, and good morning, everybody. It's fun that we're here today together, hosting this session with BT and Warwickshire County Council. As the Chief Innovation Officer here at the university, I put together a number of objectives that we've agreed on, and you can see on this slide. And you'll see it's vitally important to us that we play a leading role in supporting our region's startup and scaling businesses, to spin out our own research and to inspire the next generation of entrepreneurs. And you'll see on this next slide our strategy and our activities, which are focused on ensuring we have the right innovation places, which obviously includes digital, allowing us to bring together partners, investors and subject matter experts to inspire innovation across all of our communities. This is about open innovation. Now let's have a look at the last year. Well, 2020 has been our best year ever in terms of our outputs. It's been an incredibly challenging year. We've spent time with over 500 businesses, helping them start, scale or pivot during the pandemic, some of which needed help to survive. We've delivered over £45 million of investment for Warwick companies, and we've engaged with 7,000 people across the Warwick Innovation District. So I'm really proud of the hard work that's gone in this year to support our community. And now when I look out to 2021, our focus is to challenge ourselves further and to go to the next level. Creating 3 new incubators focused on deep tech, which includes data science, Creative Futures, which is our creative and digital incubator, and of course health and well-being, which we're talking about today. So it's a super exciting time to be working with our key partners, BT, Warwickshire County Council and NatWest, to help drive the economic recovery across the Midlands and the UK. Thanks, Wendy, and back to you.
Thanks, David. I'll now hand you over to Darren Farmer, who's our Business Technology Director at BT, and Lucy Baker, who is the Service Technology Director and Chief Technology Innovation Officer for BT. Don't forget to put your questions into the bar as we go through so that we can have some good questions and answers at the end. Thank you, Darren.
Thank you, Wendy. It's great to be here today, and hello to all those people that are joining us over the internet this morning. So I want to spend just a couple of moments talking about and framing how we got to this particular point in time, and for those people that may not be familiar with 5G, just touch on some very basics before handing over to my colleague Lucy Baker, who will focus specifically on health. So for those people that may not know, BT purchased EE back in 2015. Over the last 5 years, we've consecutively won awards for being the best network in the UK. And we've built on that in recent times by launching 5G in May last year. And that was a UK first. We now have the largest 5G footprint in the UK, with 112 cities and towns currently live. And if I look at places that I'm particularly fond of, places like Birmingham and Coventry, and now we've also got 5G, public 5G live at Warwick University. Warwick University is the first 5G campus. It's had 5G private networks on campus for a long time now, with some of their leading work that they do in Industry 4.0 and CAM development. But what we've now done is added to that by bringing public 5G networks to the campus, and that's going to benefit students, researchers, businesses, normal everyday university staff, and we're seeing demonstrated speeds on campus now of between 700 and 900 megabytes, I should say. We've also, in support of the university, expedited the delivery of 5G to other campus locations, such as Leamington Spa, in support of their creative and digital incubator out there. So for those that may not be familiar with 5G, or it might be a new concept, there's a lot of talk about it. For me, 5G blurs the line between fixed and mobile networks, and it's the first time that mobile networks are potentially being considered as enterprise grade. So 5G offers increased capacity, great improved throughputs, higher speeds, lower latency, and enhanced security. It isn't the end game though. It is a developing technology, and we will see things like ultra reliable low latency and network slicing coming over the next 18 to 24 months as standards are adopted across the industry. I see 5G as an enabler for future technologies, and it plays a really important role along with edge compute, AI and security, and it will enable industries to reinvent themselves. A bit like what we saw when 4G was introduced back 7 or 8 years ago, and we now have organisations such as Spotify, Just Eat and Google Maps who potentially may not have had the exposure or market growth without data being as pervasive as it is. And what I'd like to do now is hand you over to Lucy Baker, who is going to tell you a little bit more about what we see specifically happening in health from BT's perspective.
Thank you, Darren. Can you go on to the next slide, please? So as Darren and Wendy have mentioned, a large part of my role is working with the NHS to explore early 5G use cases across healthcare sector and really work with them to co-create solutions on how we can help them drive forward their own digital healthcare vision. And from the last 18 months with working with trust across the country, it's very clear how much pressure the NHS system is under. People living longer, many with multiple long-term conditions, and as we all know, a real shortage of doctors and nurses in the country. Not to mention the additional pressure that COVID brings. The NHS is having to try and manage a pandemic at the same time as working through a huge backlog of elective routine work, at the same time as adhering to social distancing and making sure the vulnerable shielded individuals in community get the care that they need. And also uppermost in our minds is the staff wellbeing. The NHS staff have been working best endeavours under such pressure for the last sort of 6, 7 or 8 months under the pandemic, working with the pandemic. And all these things are very much uppermost in our minds when we're developing and co-creating solutions with our NHS partners. Next slide, please. It's very clear from our discussions that the NHS realise that they need to deliver care differently. They need to transform their care delivery model. And this is about looking at what we can do in terms of taking care out from the acute where possible and moving more care out into the community and into the home. And what we're doing is co-creating solutions and developing solutions that will equip and empower health professionals in the field to deliver care to the patient wherever they are. In other words, delivering the hospital to the patient. And this is a shared vision, not only with the hospital and ourselves, but also with the broader community. So looking at community healthcare, GPs, care homes, ambulance trusts, early intervention teams. This is a shared vision that we should work on together in partnership to drive over time. Next slide, please. So our partnership with the NHS brings together The technology innovation, together with the knowledge of the care pathways, the clinical expertise and the operational adoption. And building on the concept of delivering care locally, we're looking at developing solutions and are developing solutions across multiple different care settings. From the community-based care, equipping and empower community nurses, to collaboration, driving collaboration between intermediate care centres and the acute hospitals, from a fully 5G connected ambulance to remote diagnostics for a community-based triage. Next slide, please. The next couple of slides and a video, I'd like to share what we've specifically been doing with University Hospitals Birmingham. The first video shows our 5G connected ambulance. Let's play the video.
One of the main things you do as a paramedic is go to environments that we can't control. There's always a sense of intrepidation as you approach. If we can get on top of things faster, and that is going to save some lives.
"5G is a cutting-edge technology. It's mainly focused on mobile, and it's got three major characteristics: speeds above 1 gigabit per second, massive connectivity, and the third one is low latency. In healthcare, we can imagine live transmission and sharing across two different locations between a clinician and a medic.
5G to us in healthcare is much more than just a faster 4G. It allows us for the first time to use high-definition video to transmit images of patients, images of their conditions, and also we can use it to transmit high-definition images of an ultrasound.
It's amazing how people started working together, and in a couple of months, we had the first ultrasound test that we did over 5G. We have now, a connected ambulance and capability to do a real-time diagnosis.
I place the haptic glove on my hand, I do my ultrasound as I would anyway. Doc, I wonder if I could run something by you for a minute. The physician moves the joystick left, it will vibrate, and I'll move my hand left. In the back of the ambulance, we also have a 180-degree camera. Using the virtual reality headset, the doctor back in the hospital can see a view of the back of the ambulance. That's directly linked to the ultrasound and the vital statistics. Using the augmented reality headset, I can show them what I'm actually looking at. Zoom 2. It's all audio commands, so I'm not even touching the headset. The 5G project is essentially like having an entire specialty suite within one environment. I can already phone them, but if we can get on top of things out in the community faster, it'll free up beds.
And in this particular case, in which the patient is bleeding into their tummy from their liver, allows us to make sure that they come to the right hospital at the right time. So if necessary, they can go straight into liver surgery.
It takes 15 years plus to train doctors to do some of the stuff we do here. The ability to increase the capacity of our workforce is limited by the length of time of their training. There's a huge area where technology can simply fill that gap.
I think it will be a game changer. I think it will be part of a process in which the NHS and other healthcare systems start to move into adopting new technology to improve the delivery of healthcare to very large numbers of patients.
5G opens a new culture of collaboration to transform these industries. It's not just to do it differently, but is to provide more added value.
Without embracing technology, there is simply no way we're going to keep up with demands being placed on the service.
Midwives, district nurses, pharmacists, they're all able to benefit from this 5G network, ultimately delivering better healthcare and making a big difference to more people's lives.
So the engagement with the companies delivering the connectivity is hugely important. It is the only reason that we've come as far as we have, both in terms of what we've already done, but certainly in terms of what the world could look like in a few years' time.
Using the 5G network of BT, we are transforming the way that healthcare is provided, and we want the Queen Elizabeth University Hospital of Birmingham to be the lighthouse for the UK and for the NHS.
Next slide, please. So as you can see from the film, 5G is connecting the paramedic in the field with the patient back to the specialist clinician at the hospital. The clinician and the clinician and the paramedic are connected only through audio and video capability, but also you could see from haptic technology. So the clinician moves a joystick in the hospital left and right, forward, back, and that sends control signals to the glove that vibrates, indicating to the paramedic where to place the ultrasound on the patient. This we also then further enhanced using virtual reality and augmented reality. The paramedic is wearing an augmented reality headset. Close-up footage, real-time footage could be sent over the 5G network to the clinician in the hospital for the clinician then to be able to diagnose the patient. A 180-degree camera that's on the ceiling of the ambulance is giving real-time footage to the specialist clinician back at the hospital of the overall scene of the ambulance, the patient and the paramedic. And this together with the vital signs of the patient, the medical record, the scan, the ultrasound scan itself, and the close-up footage from the head-worn camera are all sent over the 5G network in real time to the specialist clinician. This helps prepare the specialist clinician at the hospital for the patient upon arrival. It also offers the paramedic that guidance and support that is often needed. It also improves the flow through the hospital, making sure that that patient is sent to the right time, to the right specialist at the right time. And also for those borderline cases, it could also prevent a conveyance in the first place. Next slide, please. Building on the concept of connected ambulance, beginning of this year, whilst COVID was picking up momentum, as we say, and the country was busy standing up the Nightingale hospitals, University Hospital Birmingham approached us to see what we could do in terms of providing remote diagnostic capability to support the medical support within the Nightingale Hospital, and also some capability that we could use to address the care of the elderly out in the community. And we have developed a remote diagnostics capability. This is a set of a range of digital medical devices which uses our converged network, 4G, 5G and Wi-Fi, to connect health professionals in the field back to specialist clinicians at the hospital. It consists of digital stethoscope, an ECG, an ultrasound, and also a C/IC camera capability, enabling the specialist clinician back at the hospital to see what I see from the patient's bedside. The staff at the intermediate care centre where we're currently trialling can place the stethoscope on the patient, and the specialist clinician at the hospital can then listen to that patient's heart and lungs and assess the patient. This is about connecting to healthcare professionals, but also it's about bringing in a multidisciplinary team into that conversation. So through collaboration tools, we can have a multidisciplinary conversation on that one patient. You've heard Dave Rosser, the Chief Executive, talk about that it takes 15 years to train a doctor. We hope, and also the hospital hopes, that these types of solutions, connected ambulance and remote diagnostics, can go some way to addressing that gap in shortage of skills by improving the collaboration between health professionals in the field, delivering more care out in the community. Also preventing admissions, unnecessary admissions, by having that earlier triage and diagnosis. And also supporting the staff wellbeing to know that there's that reassurance and guidance on hand. Thank you very much, and I'll pass back to Wendy.
Thank you, Lucy and Darren. Don't forget, if you've got any questions for our speakers, there are some coming into the Q&A bar already, but if you've got some, then please do put them in the chat. It's time now to hear from Professor Theo Arvanitis, who is the Chair of Digital Health Innovation and the Director of the Institute of Digital Healthcare, the Warwick Manufacturing Group here at the University of Warwick. So welcome, Theo, and over to you.
Thank you, Wendy. Thank you for inviting me in this event. I will present a case study that is relevant to the concept of 5G as we discuss in today's event. This study is about the C3 Cloud project, which supports digitally enhanced integrated care. Let me start by talking about the context of this. Next slide, please. As we know, there is still an unfinished agenda on infectious child and maternal infectious diseases, child and maternal deaths. And as we have seen with the pandemic, infectious diseases might become something that we have to live in the future. But there is a strong demographic change and a shift in the global burden of disease for chronic diseases which are not communicable, and injuries. And that's a very interesting agenda that actually it is increasing, as the previous speakers told us, the cost of potentially the medical delivery and challenges the healthcare service with unproductive cost increases. Next slide, please. The context of C3 Cloud was about challenge of chronic diseases and multimorbidity. As we know, people with multimorbidity are living in Europe, and this is one of the main reasons for poor health and restricted activity. 30% of Europe's population have multimorbidities, and actually this accounts for 70% of the healthcare expenditure. What does this mean? It means that people are at greater risk for negative outcomes and increased mortality. And of course, that has overall lower quality of life for them. But they also face challenges in navigating the health and care system and actually self-managing their health. Most of the experiences people have gives emphasis to their conditions rather than how these conditions affect them. And there is a little attention on the wider determinants of health and how these impact lives and outcomes of individuals. Next slide, please. So these are the most important challenges of multimorbidity, and here's the opportunity for technology, digitally enhanced technology, to look at this. First of all, as the previous speakers talked, there is the opportunity for clinicians to improve their knowledge for assessment of multimorbidity in terms of care and support planning. But in addition to that, the current model does things in a traditional way, where we could potentially move towards shared decision making. Of course, much of the health and care system and workforce is designed to respond to single disease rather than multiple ones, and we need to move away from that. And there is a movement towards self-management and social prescribing to achieve better medium and long-term outcomes for patients. Next slide, please. And this has been the vision of Europe and many groups across Europe in terms of moving away from hospital-based approaches to managing chronic patients to community-based approaches. And of course, the opportunity for transforming care delivery is here with technology, and leveraging 5G might give us that opportunity further down the line. Next slide, please. So our proposition in C3 Cloud is to provide digitally enhanced integrated care. And what does integrated care means is that management and delivery of health services so that citizens receive a continuum of preventative and curative services. And this is based to their needs over time, but also across different levels of the healthcare system, so that we can provide a coordinated approach to that. So these approaches can be adaptive and more radical in terms of providing integrated care if they're digitally enhanced. Next slide, please. So C3 Cloud has been a project, and I will give you in a moment some of the details for the project, that has developed an online collaborative platform and a suite of digital tools for achieving digitally enhanced integrated care. There were important areas that we developed. First of all, we provided support for personalized and integrated care plan management for this type of patients, to support multidisciplinary teams to make clinical decisions across the service, and base this on evidence-based clinical guidelines, which are actually computerized. Equally, we are accessing all the data that is relevant to patients across their lifetime, and of course using data from a variety of digital sources, the medical Internet of Things, as we call it. And most importantly, making the patients and their informal caregivers part of the overall process. And we have done this not only to develop the technology, but also pilot it in the UK, Sweden and Spain in a feasibility study. Next slide, please. So this is just a quick overview of the project information. The project ran for 52 months from May 2016 to August 2020, 5 million euros from EU contribution, and the outcome of this project has managed to have 4 innovations recognized as technology ready at the Youth Innovation Radar, and the project is followed up by a new entity called C3 Crown Partnership Limited, which is basically a spin-out of the consortium of this project. Next slide, please. This gives you the range of partners that participated, and as you can see, it's a very nice mix of small, medium enterprises in the field of ICT for healthcare, academic and large research and policy institutions in integrated and health informatics related work, and of course the 3 major organizations that did the piloting in the regions of South Warwickshire, in the United Kingdom, the region Jamland in Sweden, and the Basque Country in Spain. Next slide, please. So C3 Cloud as a platform has its heart to the concept of allowing individual patients to have their personalized care plan. And these are 2 example screenshots of 2 fictional patients, one in Sweden and one in the UK, where you can see that an individual patient, based on the tools we provide and the data-driven approaches, can have individual plans that they need to achieve for managing their care in collaboration with the multidisciplinary team and in support from their family and informal caregivers. Next slide, please. Most importantly, the underlying infrastructure of C3 Cloud tries to complete this exercise by providing appropriate interoperability levels across different providers and the patients themselves through the platform. As you can see on the left-hand side of the slide, C3 Cloud uses different suites of tools that do technical, semantic interoperability of all the data that comes from electronic healthcare records, devices, social care records, and patient input into the platform through secure communication. And the clinical decision support services allow us to take the complex guidelines of multimorbidity to be resolved and reconciled when we don't look at the problem as a single disease. So, for example, here you see a diagrammatic representation of how we can take type 2 diabetes guidelines and renal failure guidelines and reconcile them by understanding interactions between disease and disease drugs, or other interactions, to be able to create reconciled and combined care plans that patients can follow and MDTs can prescribe. Next slide, please. Of course, the important part of the collaboration is between the care team, the multidisciplinary team, and the patient informal caregivers. And these are the great opportunities where 5G can play an important role. As you can see on the left-hand side of the slide, the care plan model is available through the platform, and then we have developed through SME in Finland called Medicine, a personalized empowerment platform for the patient and the informal caregivers, where they can take their care plan and have it in a way that they can manage it themselves, and they can communicate through standard interfaces and standards for healthcare ICT between themselves and the multidisciplinary care team. And of course, as part of this, in the background, we can take the data from a variety of sources. Sources that come from devices, sources that come from personal communications of the patient through their mobile phones, and of course sources of data that come directly from the interaction of the patient with the healthcare system. Next slide, please. C3 Cloud completed this work over the past 4 years, and we had, as part of this exercise, to demonstrate its validity at a feasibility level through a technology trial. So as part of our question, we try to answer if the personalized ICT tool that C3 Cloud provides can support coordinated care planning, treatment optimization, patient self-management, acceptable to both patients and their healthcare professionals. And we had different phases in this exercise, and I'm not going to go through the details of that, but we started with a co-production approach with traditional validation and verification through the technical teams, and then we involve patients through acceptance evaluations, and user interaction satisfaction, but also impact analysis of utilization, so that we have the results that we receive, which I will discuss in the next slide, please. So at the end of the studies, the C3 Cloud approach showed that the usability and technology acceptance were very positive for both the patients and the MDTs. Of course, in terms of availability, satisfaction can be increased, and this is where 5G can harness that opportunity. The studies show that we can have benefit shifts for the whole healthcare system in terms of provider organizations, time saving, saving money in terms of the payers, operational benefits for the healthcare organizations, and at the end, upscaling was suggested as part of the outcome of this feasibility study. Next slide, please. So in summary, I just presented to you a use case where we have seen that digital enabled integrated care could be a way forward, where lifestyle choices can be better tailored and promoted to the individual. So this shows that the impact of digital technology and information can be transformative for healthcare, and in particular for disease management for chronic conditions, where we can effectively support patients, their informal cares, and avoid deaths that could be prevented. Potential future development scenarios of its use can harness 5G, and in that sense, C3 Cloud provides a generic digital tool for more advanced integrated care options in the UK. Next slide, please. And I would like at this point to thank you very much and pass you back to Wendy.
Thank you very much, Theo. That was fantastic. Don't forget, any questions, do put them in the chat bar. We'll now hear from Dr. Leandro Pecha, who is a reader of biomedical engineering and the director of the Applied Biomedical Signal Processing and Intelligent eHealth Lab at the University of Warwick. So welcome to Leandro.
Thank you, Wendy. Thank you for this very interesting webinar and for inviting me in this forum. And I want to thank the speakers which have been introducing this topic before, because if we go on the next slide, we can see that, next slide please, thank you. We are a lab in which we have strong expertise in translating artificial intelligence for medical devices from the lab environment to the real world. And mainly we focus that on healthy aging and management of chronic disease. In order to do that, I'd like to stress the fact that we are a multidisciplinary lab, because we believe that in order to face complex challenges, you need to provide multidisciplinary answer. So clearly the half of our lab members are engineers, biomedical and clinical engineers, but then we have computer scientists, but then we have Alessia, she's a bioethicist, and she's looking after ethical issues which may arise by introducing medical devices both in high-income countries, but then also in lower-income countries. Then we have Tim, which is a mathematician, Carlo is an health economist by background, Katie, she's a biologist, because we really believe that this convergence of technology deserve multidisciplinary approach. Next slide, please. And here I'd like to reflect on how medicine has been evolving in the past 200 years. So if you look at the above and the below, you see that still we have a medical doctor, we still have 3 nurses, and we still have the patient in the middle. I would rather say that nothing has really changed. apart from the environment in which medicine is delivered. So all the environment which has changed is basically technology, it's the result of innovation. And if we go on the next slide, if I think to the word medical device, in this moment I have in mind more than 600,000 different objects, spanning from a very simple device such as a condom to a very advanced positive emission tomography machine. So they span over a wide and impressive range of different technologies that, experienced by medical engineers, they put together in order to improve quality of life. And if we want to have a proxy on the future, you can see on the next slide, what I like to use is the number of patent applications per year. And those are the numbers in Europe compared among medical devices, the yellow line on the above, and the drugs and biotechnologies below. In this moment in Europe, we have something like 12,000 novel patent applications per year. And this means if you reflect 1,000 per month, and if we work, what, 20 days per month, this now means 50 novel patent application per day. And if I want to estimate that we work, what, 10 hours per day from the very eastern part to the very western part of Europe, this brings the number to 5 novel patent applications per hour. And this means that by the time you are attending this webinar, 10 novel patent applications have been filed, all in the domain of medical devices. They will not become all medical devices, obviously, probably one out of hundreds. But still, this is an impressive number that I like to present together with the next slide, which remind us that the time to the market is becoming shorter and shorter. 10 years ago, I would have said that 10 years is a good time to move from the patent application to the market. Now this time is shrinking. Now this is up to 1 year. And together, those two numbers means that we are going to face a tsunami of medical devices, which is completely reshaping the way we deliver care in modern hospitals and other environments. If we go on the next slide, I would like also to present a couple of use cases on which we are working now. This is the Gatekeeper project, started 2 years ago, which is the wider project ever financed in Europe on this topic, which is exploring how artificial intelligence, Internet of Things can improve quality of life in later life, both in healthy adults, but also in chronic senior patients. In order to focus on artificial intelligence, we need impressive numbers. This project will recruit 40,000 patients in Europe and few more in 3 pilots which joined us from the southeast of Asia, Singapore, Taiwan, and Hong Kong. And we will look on an array of different conditions which are typical of later life, from COPD, congestive heart failure, diabetes, and many other conditions, which unfortunately in many cases they also come together. And in all those conditions, we need to early detect worsening of health, which if detected on time can trigger intervention, which will result in low-cost intervention with higher impact, maintaining as high as possible the quality of life. If we go on the next slide, you can see that this is also the result of a strong collaboration among several research institutions, but then also large, small enterprises, healthcare providers, and also, in this case, standardization organization, because nothing can be done if we don't talk all the same language. And if we go on the next slide, the main focus of this is coming from this pyramid. As Theo correctly mentioned before, in later life, we have senior citizens, which they can be in very high quality of life and fit and in a very healthy status. But if they move from their healthy status to become patient, this is what really triggers the public expenses. So if I jump from this lower level of the pyramid to the next level, now the expense per capita becomes 3 times higher. So that's what the NHS has to spend per person if we move from healthy aging to getting into one of those worsening. And that's really a huge amount of money, because I would say that 30% of the global population, and certainly in Europe, is in this stage now. So that's where we need the majority of the intervention, when senior citizens are still healthy and fit, and with little intervention, we can still achieve impressive results. If we move on the next slide, I will quickly mention the second project that we have been awarded this year, which is the Odin project. This is another large-scale pilot. The former was 24 million, This one is 13 million overall cost, in which we are exploring how to introduce novel technology to design the hospital of the future. Also in this case, we have research institutions, large and small industries and hospitals working together. And if we go on the next slide, we are in particular trying to face 11 challenges that were identified as the main challenges for hospital, spanning from logistic, regulatory issue, energy consumption, security, reducing hospital days, increasing quality, increasing communication with the health community. And we are using 3 key enabling technology: artificial intelligence, Internet of Things, and robots now. And we are doing 3 things. Enhanced workers, so we are using exoskeleton to help a nurse to lift up a patient, for instance, or autonomous vehicles, now robots, which where we can delegate functions which are now done by human beings, which can focus on a more emerging and risky activity. But also the medical location, what we call the enhanced medical location, places such as an ICU or a surgical theater, which now, because of IoT and robots and artificial intelligence, can support the work done by the healthcare professional in those complicated environments. And if we go on the next slide, those are my take-home messages. So my point here is that there is a clear need in order to face challenges in healthcare, mainly arising from the fact that population is aging, and those are both in the hospital, but then they are also in the community. So we need to integrate hospital and community, and we need together to envisage the hospital of the future, where we cannot imagine to face novel challenges using the old approach. We need novel technology and novel procedures. And many of those challenges can be faced with technology, which is already there. What has been mentioned before by David is Industry 4.0, where actually in Warwick and in the workshop we have a lot of expertise. And we can use artificial intelligence, Internet of Things, and robots as far as we face the challenges which are closing my slide, because we need really to have more reliable connections. We need to have the capability to monitor in real time processes, which actually they generate huge amount of information. And this information, to be really effective, to be really managed safely, needs to be conveyed in real time with no lag, with no possibility to lose track of communication and other things which may happen with all the underlying infrastructure. Last but not least, we need to scale this up at national level and, if at all possible, beyond the national level. And I believe that's my last slide. And if you have any question from the audience, I would be more than happy to take it later. Thank you. Back to you, Wendy.
Thank you very much, Leandro. That was fascinating as well, and I'm sure there'll be lots of questions for you later. So we're going to move on now to Robert Franks, and Robert is the Managing Director of West Midlands 5G Limited. Thank you, Robert.
Good afternoon, everyone. As Wendy mentioned, I'm Robert Franks and I'm the MD of West Midlands 5G. And I'd like to thank Wendy and David and BT for giving me the opportunity to close out this exciting launch event before we go to Q&A with a couple of words. So I want to take a few minutes to talk about what this exciting partnership means for the West Midlands region. 2 years ago, the West Midlands set ourselves the ambition of becoming the best connected region for 5G and to test, prove and scale new products and services using 5G technology in sectors where the West Midlands has strengths, where 5G can make a transformative difference to citizens, public services and businesses. And to execute this business, we set up West Midlands 5G, which is the organisation I lead, to work in partnership with government, mobile operators and organisations across the region and beyond to deliver bold initiatives to accelerate 5G and the innovation around it. As you've heard from today's speakers, it's hard to think of a more important sector in which to deliver 5G innovation than health and social care. As we all know, the sector is under huge pressure, not only given COVID, but also given long-term trends, as various of the speakers have mentioned, including the growth of the ageing population, chronic diseases and obesity. Furthermore, it's a sector where 5G's potential to transform the way we deliver healthcare, both in terms of prevention, diagnosis and treatment, is now starting to be proven at an early stage
by reducing the conveyancing of patients around the system and showing the potential to provide care at point of patient need. In addition, it's hard for me to think about two more capable players coming together to execute this partnership than the University of Warwick and BT. Warwick Medical School leads world-class research working in partnership with the NHS and other international institutions, and incorporates biomedical research programs and one of the largest clinical trials units in the country. And BTE was the first operator to launch commercial 5G networks in the UK, including in cities in the West Midlands, and as you've also heard, has already led a number of pioneering 5G health use cases. So my organisation will be working closely with BT and the University of Warwick to support this exciting partnership in three main areas. Firstly, we'll be continuing to work closely together to accelerate the rollout of 5G networks, looking beyond the Warwick campus into adjacent areas, so we can make sure as many health and social care professionals are connected to this exciting new technology as possible. And the way we're doing that is through continuing our barrier busting programme, working in partnership with the operators, the local authorities and others to make it much easier and cheaper to roll out these important new networks. In addition to that, we'll be looking together to work together to progress health and social care use cases, building on some of the work we've started through our own 5G health and social care testbed. And finally, we'll be looking to work together to crowd in entrepreneurs and other businesses which are looking to develop new medtech products and services, building on technologies like 5G and expertise from the university, so that hopefully over time, not only can we improve patient outcomes and the productivity of the healthcare system, but we can also fuel new jobs and economic growth. So in conclusion, Wendy, I'm very excited about supporting this new partnership, and back to you, please.
Thanks very much, Robert. Well, for me, that's been a fascinating set of cases and examples of ongoing work. I mean, robotics, remote diagnostics, wearables, cloud tech for medicine, just some examples that we've been showing there of the art of the possible. I'm sure there are thousands more cases waiting to be discovered and utilised. And the value of joining people and companies and experts and equipment and space and expertise and mentors together to speed up the delivery of these new interventions is just so exciting. I'm really looking forward to hearing more from what's achieved through this. So I've got a lot of questions now in the question box, so thank you very much. It's been very busy. We'll try and get through as many of them as we can. So if we start off with one then that we've got here from Kira that says, as a clinician, the impact and outputs of touch is vital. Do you see the use of tech de-skilling our clinicians? And I think if I can put that question there to Leandro to answer.
Yeah, thank you. I completely agree. Obviously, if we have the possibility to see the patient in person, there is nothing better than that. And we mentioned touch here, but we know that from the very early days of medicine, every sense has been used in order to foster diagnosis and to establish proper contact with the patient by how the patient moves, the smell, and many other things. We are not yet capable to reproduce this, and nothing will ever replace a medical doctor. What we are saying here is that we can probably use technology to fill the gaps which are coming out because of shortage of personnel, because of the increased number of population, especially in the later life. And that's not a problem. This is an opportunity. I mean, we are really happy that nowadays we have much longer life and a very active life in later life. But we need to do more. We need to make those environments more proactive, as we have done for hospital. As I showed in my slide, we moved from 200 years ago with very little technology in a surgical theater to now, when we have robots, which we use in order to perform medicine. We probably are called to do the same shift also in private housing. So we moved from houses hundreds of years ago where they were not so clean, not so great environment to live in, to houses as they are now, extremely clean, extremely dry, not at all wet. Probably in future, the house will be the proactive environment in which well-being and health will be fostered. I hope this answered the question, Wendy. Back to you.
Thank you. Thank you. Lucy, I think you wanted to give some more on that as well.
Yeah, I was thinking just through the bit that I talked you through around the remote diagnostics, we look at it as actually this is an opportunity to upskill those less experienced. So those less experienced going out into the community, but being supported remotely by the clinician, specialist clinician back at the hospital. And I also think that whilst the sense of touch, obviously incredibly important, the quality of the video that we have from sort of the see what I see camera capability, that, you know, the doctors and the clinicians so far, the feedback from them has been, you know, they're able to diagnose skin conditions such as dermatitis, cellulitis, look at someone's complexion in that, you know, in that real-time nature. So I think there is a balance off here, but I think it's important that actually we're looking at actually being able to help upskill the maybe less experienced people going out into the community.
That's great. Thanks very much for that, both of you. There's a question in the chat bar about how we would like small and large businesses to engage directly with the Innovation District so they can access support and get involved. So what I've done is I've posted in there the Innovation District web pages, so that's the best place to get that information, I think. I think that's answered that one. How long before all of the UK is 5G? So that can go to Darren, I think.
Thank you for that one, Wendy. So I suppose that's a really difficult question to answer. I suppose the reference point we've got is how long it took us to roll out 4G, and that has been a continuing program that's been taking place over the last several years. So 5G, isn't going to come overnight. It is going to take us a number of years to roll out across the whole of the UK. And we've got I can only speak from BT's perspective, we've got a plan that does see us expand the services out. If you look at where we've come in just a year, in places like Birmingham, where a year ago we had no coverage, and we launched in that city, and we've now got over 50% saturation in that city, and it's continuing to grow. So it will come. Obviously everyone's really excited about it coming and want to get their hands on it. They want to make use of it. But it will take us some time, and there are some other complexities that come with the use of 5G in areas such as especially dense areas, where we have to look at not just upgrading our existing network, but augmenting that network with new technologies such as small cells and other services.
And Darren, just while you're still on there, the subsequent question is what testing has been done on its usability on the university campus?
Well, as you can imagine, like anything, it's new toys, isn't it? So there's been quite a lot of testing done on that network and those services. It is a public network, so we go through a rigorous program of works from an engineering perspective before we make anything live. So the delivery of that capability on campus was a while in the planning. It's been deployed in a normal way as it would any other cell site on our network. So it's passed all the tests there. And of course, it's a big campus. 5G signal does vary across that campus, but we're seeing some excellent results. Up to 900 meg.
Thank you for that. That's very helpful. So another question now, and I'm going to direct this. I'll give the production team a bit more notice. So I'm going to direct this one at Theo. So Theo, how does the C3 cloud work with electronic patient health records? The NHS has so many different systems. How will this align?
Thank you, Wendy. So in C3 Cloud, we have taken an approach of standardization to interoperability technically for healthcare records. For the cases we had in the pilot size, wherever it was appropriate to use the HL7 standard for extracting and communicating the data across the electronic healthcare systems, this was possible. In the case of the UK, for example, we used two different systems. One was standardized, the other was more homemade to the clinical practice that it was used. And for that particular case, we developed mapping software that allows the data to be transformed at a standardized form, and all the objects and the data elements have been collected and available as the HL7 FHIR standard. So this is the approach we are taking.
Thank you, Theo. So a question now on how can we join BT at Warwick? Can we discuss our business and how BT can help us? So perhaps I'll direct that first to David Plum.
Thanks, Wendy. Yes, I mean, we'd be delighted for businesses to get in touch in terms of how we work together at Warwick. Wendy shared the warwickinnovationdistrict.com website link earlier. That's a great place to go to find out what's going on. We run programs like Business Ready, where we can offer new opportunities to both starting and scaling businesses. But as I said, we're also focusing on some new particular focus sectors like creative futures, deep tech, and health and well-being. So if you go onto that web page, you can register to be involved. You can say you want to be a mentor, or you just want to receive news. So that's a great way of really getting involved with us here at Warwick. And then perhaps I'll hand back to Wendy or Darren to talk about the BT element.
Back to Darren, I think would be grand.
Yeah, so there's a number of ways, Wendy, that that people can get in touch, either through the connections with the university, or people can contact us directly. We'll happily engage and help facilitate conversations with the relevant parties.
That's great. That's great. Thanks very much, Darren and David. So we've got one here. I think this is going to go to Theo. Remote medical information for devices and tools require a high degree of security. Can you please elaborate on this concern?
I think I would agree. We follow the development of this kind of solutions by following a very rigid approach to privacy and security that follows not only the law but requirements that, for example, in the case of the UK, the NHS and the Caldecott principles require us to have. So I think the technology at the moment, it's very fit for that, but there are also organizational issues that we need to continue to have and adapt our principles to the new world of remote medical information.
Thank you. I'm just wondering if there are any other members of the panel who'd like to come in on that. So I think maybe Lucy, is there anything from BT's point of view?
I mean, in terms of what we've shared today, everything we're doing at the moment is in real-time sharing of information, but absolutely I echo everything that Theo has just said, and said obviously the next phase will be us to explore the opportunity actually then uploading and storing information from these remote diagnostic assessments and triage appointments into electronic patient records, etc. So I think that I echo all his and we, you know, echo everything that Theo's just said.
Thank you for that. So I've got one here that says integrated care is great, but it depends on a change in approach to merge the NHS trusts and social care budgets held by local councils. Concerned that until we have a joined up model, we are likely to see the primary focus on managing budgets rather than managing patients. How will 5G help to facilitate this? So who do we think is going to have that? Should we...
I'm happy to answer that, Wendy.
Fabulous.
Yeah, so I think I agree. This is sometimes a chicken and egg situation, but I don't think we should start only from that. The feasibility study we did in C3 Cloud showed exactly that the disruption that you might have through technology, and of course 5G allows better communication, better coordination between people at different places and from different organizations, has shown that indeed, even for the UK, through the CCGs, the payers' benefit in terms of budgets is quite high. And because of that, and because of the need we have to change our organizational model, probably we need to see this from both sides. Yes, indeed, we need to think about budgets, but also we need to think how we best disrupt our organizational models at the moment with the introduction of the new technology. I hope this answers the question.
Thank you. And I think Darren's got something to add there.
Yes, Wendy, I think what we've seen across the health sector is a coming together, a much more collaborative approach, and much more awareness of the challenges that are facing organisations outside of their own. So, whether this is ambulance trusts or acutes or even local authorities coming together, they know that if they keep working in the way that they do and working in silos, actually all that's going to happen is you're going to contribute to a problem that's not going to go away. So we're seeing a much more collaborative, supportive, engaging approach across many organisations, all looking to work together to in some instances put budgets aside, because they know if they work together operationally and financially, it will lead to better patient outcomes.
Thank you. It's interesting to see how those can work together. And a question that follows from that really is around how we get maybe the Public Health England engaging with the NHS and with individuals. And sometimes those messages aren't always aligned. So how can we get the Public Health and the NHS relationship better for managing citizens? So I wonder if you want to come back on that. Maybe David.
I can probably.
Sorry, Wendy, I was looking at the questions next, so you'll have to repeat that one.
Talking about how the relationship between Public Health England and the NHS, they need to engage with each other and not just necessarily direct with patients. Is the challenge about structure, or is that challenge about putting people together better? It kind of follows on from the answers from Darren and Theo around silos and effective working, but I wondered if you've got anything to add in there.
Yeah, I mean, I think the only point that I would add, and I think the Health and Wellbeing Incubator is us really making a nod to this, is that we need to bring together different disciplines, different communities, and create spaces, programs, mentors and investment so that the structure is there for people to work together on, I think, some of these challenges. When we've proven the challenges and we have real data, and I think we've seen today two great examples of projects that have real outputs and data, then our job in the innovation district is to think about how we might commercialize that. So we do help within the health setting. We do think of it as a system. We are solving some of those systemic challenges, but we're solving them by recognizing they're commercially successful. We therefore hope to create new companies or new services from existing companies, which will go out to sort of take to all of the various trusts the things that we establish in our innovation spaces. So I think it's thinking of it in a system and finding the outputs are at the heart of it.
Thank you. That's good. I'm conscious of time, so I've got a couple more that I just really would like to get in, so I'm going to skip down to those. One directed at Leandro, I think. So nurses contribute a large proportion of the healthcare workforce, and a large proportion of those are over 55. How do you envisage getting buy-in from groups who might be tech phobic to work on these products and innovations?
Thank you, Wendy, and this is a very good question. I believe in this space there are three main barriers. One is organizational, and has already been discussed before, how to integrate different units in the same organization, which is very complex, the NHS. The other is budget, is money. This technology sometimes is still perceived as additive in terms of cost, while they should be seen on a medium or long-term period, where actually they save cost if they are well integrated with processes and processes are transformed together with the introduction of technology. If you just look at technology, is cost. If you look at technology which is changing now the way NHS does, then this is cost saving, and there is plenty of proof of that. Last but not least brings me to this question. Still, we have a very large part of healthcare professionals, mentioned before nurses, but this extends also to other members of the NHS community now, which are not very fluent with technology. The answer here is dual. First of all, this technology is becoming more and more user-friendly, as David started and Theo commented, and we also have this in our project. This is co-creation. We are not asking them to use our technology. We are asking them to be part of the team, and together we will design the technology that they are going to use. So it's not our technology given to them, it's their technology, and they have to step forward. So my answer to that is that they are well acknowledged as key actor of this community. They need to take the power and participate to the co-creation effort that Theo is leading in a wonderful manner in the Midlands in general. So we are very open to that, and the answer is co-creation. And we need more investment. Certainly training is crucial, and we need to see people with different background in the NHS. The fact that in this moment we don't have yet enough engineers, that's an issue, because this technology is coming as a tsunami, as you have seen. And the risk I see there is that we don't have enough expertise in order to profit maximally from this experience. And last but not least, this COVID has been a huge drama. It's been an emergency which has, brought us from us beloved people, and that's a real drama. But this has also come with very powerful impact on the way the NHS is approaching innovation. We have been involved in a project with the NHS6, and I have never seen something like that. In 3 months, we went from the project to the app, which is used by oncological patients in order to be followed up by their own oncologists. I've never seen something like that. 3 months, and they uptake technology which was not there before. That's novel, and I believe there is a huge momentum now to bring this kind of innovation into the NHS in the UK. Back to you, Wendy.
Thank you. And I think that the final question that we've probably got time for is a quick one for Robert. Robert, what sort of communication about what 5G is planned for consumers? Has it started? And if so, what's the feedback?
Thanks, Wendy. So I think there's still a lot of experimentation going on in lots of exciting spaces around what 5G could mean for consumers. One of them we've obviously just been talking about, which is how it can transform health and wellness. And we're working with, BT, the university, and others to try and share some of those exciting case studies, exciting benefits. Other areas, so I think creative industries, as you're coming on to talk about with your partnership with BT shortly, I think is a second area. So when we look at the growth of gaming that we've all seen during lockdown, of esports, of new formats coming out comprising XR and all sorts of things like that, I think there's some exciting use cases around that. Transport is another big area of focus for us across the West Midlands. So we have leadership through things like Warwick Manufacturing Group in key areas of transport, and I believe there's a huge opportunity for 5G to contribute both to helping get people back onto public transport over time and driving also some industries of the future around transport, things like electrification and connected autonomous vehicles. And I think, as Darren mentioned very briefly, the university already has a very impressive CAV facility with some cutting edge private 5G networks as well. So I don't think I can give you a completely comprehensive answer on all the 5G use cases on the consumer side, but those are 3 key areas within the consumer space that we're actively partnering to explore with a number of other organisations here on the webinar today.
That's absolutely fantastic. Thank you so much. I think all that it remains now for me to do is to say a huge thank you to everybody for attending, for the brilliant questions. We have run out of time to do the questions. We have more. What I will do is we'll put some answers there. If you haven't received an answer, do contact us direct, and I will get you in touch with the right people and answer those questions. So thank you to all of our panelists, our speakers, and thank you to the support team behind the scenes who've helped to bring this to life as well. Please do join us if you can. Please do register to at least get newsletters, but please do more. It's part of a really, really exciting stage of growth, both with the university, our partnerships with BT, with others, and the growth of innovation in health and wellbeing in the region. So thank you all very much. Goodbye.